There's a moment many of us know too well, a sudden tightening in the leg in the middle of the night, or a sharp pull in the back during a stretch. We wince, rub the area, and often call it a cramp. But is it always just a cramp? And could it be something more serious, something deeper beneath the surface? Muscle cramps are common, often harmless, and usually go away on their own. But when muscle contractions persist, come without a clear trigger, or are accompanied by other unusual symptoms, it might be a sign of something more concerning, a pathological muscle spasm. While both involve involuntary muscle tightening, their nature, origin, and implications can be vastly different. Misunderstanding the two can lead to mistreatment or misdiagnosis, especially in older adults or those with underlying neurological or systemic conditions. Understanding the subtle yet crucial differences between a regular cramp and a muscle spasm caused by a medical disorder isn't just about knowledge. It's about safety, prevention, and timely care. In this article, we will gently uncover 5 essential differences between ordinary cramps and pathological muscle spasms, from their causes to their sensations, their duration to the potential red flags they carry. Each distinction holds value, especially for those who experience frequent or unexplained muscle issues. Let's begin this journey, not just with curiosity, but with care, because sometimes what feels small may be the body's quietest call for help. Part 1. Cause and underlying mechanism. Not all pain comes from the same place. Some emerge from surface strain, others rise from deep within the nervous silence. It begins with a twitch, a ripple in the muscle. Then comes the tightness, a sudden knot that pulls hard and won't let go. For many, this is simply a cramp, a natural response to strain, dehydration, or fatigue. But sometimes, what feels like a cramp is actually a symptom of something much more complex, rooted not in the muscle itself, but in the fragile, intricate pathways of the nervous system. Understanding the difference starts with the cause. The nature of muscle cramps. Cramps are a common experience, affecting nearly everyone at some point in life. They are most often the result of temporary muscle overuse, electrolyte imbalance, poor circulation, or even prolonged inactivity. Picture a runner finishing a marathon with calves seized tight, or an older adult stretching after a long nap and feeling their foot curl involuntarily. These are classic settings for a benign cramp, sudden, intense, but fleeting. The biology behind these cramps is fairly simple. Muscles contract when nerve signals tell them to, and they relax when those signals stop. But when there's a disruption, perhaps from too little sodium, potassium, or magnesium, or from tired muscle fibers firing erratically, that signal can become distorted. The result is a brief involuntary contraction, a cramp. It's unpleasant, but in most cases harmless. Cramps are, in essence, a local phenomenon. They arise from the muscle's own environment, its hydration level, its workload, its mineral content. The brain and spinal cord, while ultimately in charge, are not typically at fault, the root of pathological muscle. Spasms, pathological muscle spasms, however, tell a different story. These are not merely about the muscle being tired or thirsty. They are often symptoms of deeper neurological or systemic dysfunctions, where the muscle is an innocent bystander, responding to flawed signals from higher up in the nervous chain. Here, the cause may lie in central nervous system disorders like multiple sclerosis, spinal cord injury, cerebral palsy, or Parkinson's disease. In other cases, peripheral nerve damage, such as neuropathy from diabetes, nerve compression from herniated discs, or even autoimmune conditions like ALS, may be the culprit. The muscles receive abnormal signals, often excessive or poorly regulated, leading to sustained or unpredictable spasms. Unlike regular cramps, these spasms can happen without warning, without exertion, and even without pain at first, making them harder to recognize for what they truly are. They may feel like tremors, clenching, or waves of tension. Over time, they can contribute to stiffness, difficulty walking, and reduced quality of life. Whereas a simple cramp might be compared to a thunderclap on a summer day, brief and noisy, a pathological spasm is like an underground fault line, slowly shifting the landscape, often without visible signs, until something ruptures. A matter of origins. muscle versus mind. To put it plainly, cramps are born in the muscle, while pathological spasms often begin in the brain, spinal cord, or damaged nerves. That distinction matters profoundly, not just in treatment, but in what the body is trying to communicate. A cramp may simply be a request, "Please rest." A pathological spasm may be a cry. Something is wrong inside. Understanding this difference is not meant to cause fear, but to foster awareness. We cannot ignore the body's language, not when it whispers and certainly not when it clenches. We are steadily working our way toward the milestone of 1,000 subscribers, a small number, but a big dream. If you enjoy content about health, especially about cramps, please hit subscribe to help power our journey forward. Thank you so much. Part 2. Duration and recurrence. Some discomfort comes and goes like a passing wind. Others linger like a shadow you can't quite shake. Audi. First time it happens, it startles you. A muscle tightens sharply, a sudden surge of discomfort, maybe even pain. You breathe through it, stretch, and within a minute or two it's gone. Life goes on. This is the familiar nature of a typical cramp. But what happens when it doesn't go away? When the sensation returns day after day, or lasts not seconds, but minutes or longer? Here lies one of the clearest, most telling differences between simple cramps and pathological muscle spasms, their duration and their pattern of recurrence. Cramps, fleeting and episodic muscle cramps, in their most common form are brief and predictable. They rarely last more than a few seconds to 2 minutes. Their onset is sudden, but their exit is just as swift. They are often isolated incidents, triggered by an intense workout, poor hydration, or a long day standing. For example, a leg cramp during sleep might awaken someone abruptly. The pain is sharp, the muscle tight, but with a bit of massaging or repositioning, relief comes quickly. The body returns to baseline. There's no residual tightness, no lingering sense of dysfunction. And while some people, particularly older, adults or athletes, may experience cramps more frequently, even recurrent benign cramps tend to follow patterns. They may be nocturnal or occur after specific physical activity, but they are generally short-lived, and their recurrence is often manageable with lifestyle adjustments. Pathological spasms, persistent, repeating, and resistant pathological muscle. Spasms don't behave this way. Instead of lasting seconds, they may stretch into minutes, hours, or even become a continuous baseline state of tension. In some neurological conditions, the muscles are in a near-constant state of contraction, a phenomenon known as spasticity. In others, the spasms come and go throughout the day, triggered not by exertion but by reflex, movement, even emotional stress, and they come back, again and again, not just after overuse or dehydration, but unpredictably, in rest, in motion, in sleep. They may persist for weeks or months unless the underlying cause is addressed, and unlike typical cramps, these spasms are often resistant to stretching, hydration, or massage. The root issue is not in the muscle's environment, but in its command system. Some patients with conditions like spinal cord injuries, multiple sclerosis, or dystonia live with this recurrence daily. Their muscles can stiffen without warning. Their posture altered by forces they cannot control. What the outside observer may mistake for restlessness or tremor is often an internal battle with recurring, involuntary contractions that never fully let go. What duration tells us, in many ways, time is a symptom. The difference between a short burst and a prolonged siege can be the difference between reassurance and the need for further evaluation. Ask yourself, did it stop within a minute or two? Is this a one-time event, or is it happening regularly? Does it respond to rest or gentle movement, or does it feel like something that won't yield? If the discomfort lingers beyond the moment, returns frequently without an obvious trigger, or seems to spread or intensify, it's time to consider that the body may be whispering something more serious. A gentle reminder pain is never meaningless. But neither is its duration. A cramp that comes and goes is like a door that opens and shuts, but a spasm that lingers and returns is a door stuck halfway, caught between motion and stillness. And often behind that door lies a deeper story the nervous system is trying to tell. Part 3. Associated symptoms. The body rarely speaks in a single word. When something is wrong, it often tells a fuller story, if we are quiet enough to listen. A cramp, in its simplest form, is a lone note, sudden, sharp, self-contained. It arrives quickly and leaves without leaving a trail. But what if that note is joined by others? What if the muscle tightens and your foot tingles, or your hand clenches and you lose grip strength? This is where we must begin to look beyond the cramp itself, to see what accompanies it. Because here lies another vital difference. A cramp tends to stand alone, while a pathological muscle spasm often brings companions, other symptoms, that hint at something deeper, more systemic, more persistent. The solitary nature of cramps in most people, especially healthy individuals, a cramp is just that, a single symptom. A calf tightens during a jog, a toe curls involuntarily in bed, a finger locks briefly after prolonged typing. It's uncomfortable, even painful, but it's an isolated event. There's no numbness, no loss of coordination, no radiating pain, and no lasting impact. Once the muscle relaxes, function returns immediately. There's no sense that something is wrong elsewhere in the body. It's an annoyance, not a warning. This simplicity makes cramps easy to identify and manage. When no other symptoms are present, the muscle cramp is usually the body's way of saying, "I'm tired, I need water, I've been overworked." But when other signs appear, when the muscle tightens and something else happens, the story changes. The complexity of pathological spasms. Pathological muscle spasms often exist within a constellation of symptoms. These spasms may be accompanied by numbness or tingling, paresthesia, a warning sign that nerves are irritated or damaged, muscle weakness, suggesting that motor control is compromised, not just tightened, tremors or involuntary movements, indicating potential dysfunction in the central nervous system, chronic stiffness or spasticity, where muscles remain partially contracted for long periods, affecting mobility, fatigue, or slowed coordination, reflecting broader neurological involvement. Back pain, radiating leg pain or shooting nerve pain, often associated with spinal cord or nerve root involvement. Take, for example, a patient with multiple sclerosis. Their leg spasm may not just be tightness, it may come with heaviness, poor balance, and a sense of internal shaking. Or consider a person with diabetic neuropathy. Their foot spasms may arrive alongside burning sensations or an inability to feel touch normally. These additional symptoms are not separate issues. They're part of the same pathological process, and it's these added layers that should guide the next step. When a cramp is not alone, we must ask, what system is affected? What message? Is the body sending that I've ignored? A story told in chorus, not solo. Think of the body like a symphony. A cramp may be a single off-key note, but a pathological spasm, especially when joined by numbness, pain, or weakness, is a whole section playing out of tune. And in a symphony, when multiple instruments are playing wrong, it's not the fault of a single violin. It's a signal that something is wrong in the conductor's hand. These associated symptoms are that signal. They are the deeper hum beneath the surface pain. They're not just uncomfortable, they're diagnostic clues. So if your body speaks, not just in tightness but in tingling, not just in cramping but in collapse, do not hush it. It may be time not for stretching but for listening, for scanning deeper, for reaching out to those who understand the language of nerves, not just muscles. Part 4. Response to intervention. How something heals or refuses to often reveals more than the wound itself. When your muscles cry out in pain, the first instinct is to soothe them. A stretch, a gentle massage, a sip of water, and for many this is enough. The cramp fades like a storm that's passed. Relief comes swiftly, almost reassuringly, but not all muscle pain responds so kindly. Sometimes, no matter how much we stretch, hydrate, or rest, the tension holds on, persistent, resistant, quietly telling us, this isn't just about the muscle. And that is where the fourth key difference lies, how these two types of muscle events respond to care. Cramps, responsive and reassuring. One of the reasons cramps are rarely cause for alarm is that they often respond beautifully to simple interventions. A sudden calf cramp during the night, gently flexing the foot can relax the muscle. A hand that tightens after long typing, a warm compress and a break from repetition can bring relief. In fact, cramps tend to follow a predictable therapeutic pattern. Stretching the affected muscle often ends the contraction. Hydration and electrolyte replenishment, especially magnesium, potassium, or calcium, reduce recurrence. Warmth eases tension. Massage promotes circulation and return to normal tone. These methods work because the problem is local and transient. The muscle is simply overworked or chemically imbalanced. Once those conditions are corrected, the body restores itself. For most people, managing cramps is a matter of lifestyle adjustment. They feel better within minutes, and the episode becomes just a brief inconvenience, not a chronic concern. Pathological spasms, resistant and revealing, but with pathological muscle spasms, these same soothing efforts may offer little to no relief. A person may stretch, and the muscle remains tight. They may hydrate, adjust posture, or even try heat therapy, and yet the spasms return or never fully go away. Why? Because the origin of the problem is not in the muscle itself, but in the system that controls it, the nervous system. In cases of neurological disorders like spinal cord injury, stroke, multiple sclerosis, or ALS, the signals that regulate muscle contraction are damaged or misfired. So the muscle isn't contracting out of fatigue or thirst, it's obeying a command it never should have received in the first place. In these situations, treatment becomes more complex. Standard interventions may not work. Instead, care may involve prescription muscle relaxants, like baclofen or tizanidine, anti-spasticity agents to quiet overactive nerve signals, Botox injections to weaken over-contracting muscles, physical therapy, focused on nerve retraining, not just stretching neurological assessments to uncover deeper causes. Sometimes, the spasms may reflect a structural issue, like nerve root compression in the spine. In such cases, no amount of massage will help. Only targeted medical or surgical treatment will address the cause. Relief is a clue. Relief, or lack of it, becomes more than just comfort. It becomes a diagnostic tool. If the pain yields easily, it's often a surface-level issue. If it holds firm despite every remedy, it may be the echo of something deeper. And in medicine, as in life, what resists change often deserves the closest attention. Listening to what doesn't change, the body wants to heal. That is its nature. So when it doesn't, when something won't let go, that's not just dysfunction, it's communication. A cramp that lets go says thank you. A spasm that doesn't says look again. Part 5. Clinical implications and risk factors. Behind every symptom is a possibility, and sometimes a warning. A muscle tightens and we wince. That's the body's language. But in medicine, every message must be interpreted with care, because not all discomfort points to the same future. Some aches are harmless ripples in the water, others are the first tremors of a deeper storm. This is the final and perhaps most crucial difference between cramps and pathological spasms, their clinical implications and associated risks. What they mean, what they may foretell, and what we, as patients or caregivers, must not overlook. Cramps. Benign, inconvenient, and often preventable. In the overwhelming majority of cases, simple muscle cramps are not dangerous. They're irritating, sometimes painful but rarely serious. Most are the result of temporary overuse or exertion dehydration. Electrolyte imbalance, poor circulation in a specific muscle group, long periods of immobility. Cramps often occur in healthy individuals, athletes, pregnant women, older adults. They tend to respond well to self-care and do not usually require medical intervention. Even when recurrent, such as in nocturnal leg cramps, the clinical consequences are minimal, aside from sleep disturbance or transient discomfort. Still, chronic cramps can be linked to underlying issues like magnesium or calcium deficiency medication side effects, e.g. diuretics, statins, circulatory problems, but again, these are usually manageable and the cramps themselves are not directly harmful. The bottom line: cramps are a flag, not a fire. They ask you to pause, replenish, and adjust. Rarely do they demand anything more. Pathological spasms, signals of deeper disease. By contrast, pathological muscle spasms can be early indicators or ongoing consequences of serious neurological or systemic conditions. Their presence should always prompt a deeper look, especially when accompanied by other symptoms like weakness, numbness, tremors, or coordination difficulties. Common underlying causes include central nervous system disorders, multiple sclerosis spinal, cord injury, cerebral palsy, Parkinson's disease, stroke aftermath ALS, amyotrophic lateral sclerosis, peripheral nerve disorders, diabetic neuropathy, nerve root compression, EEG, herniated disc, toxic neuropathies, chemotherapy, alcohol, metabolic or systemic diseases, liver failure, hepatic encephalopathy, kidney failure, uremic neuropathy, thyroid dysfunction, autoimmune neuromuscular conditions, stiff person syndrome, myasthenia, gravis dystonia syndromes. In these cases, spasms are not the problem, they are the messenger. The real concern lies in the system that misfired, the circuit that failed, the cell that degenerated. Unlike benign cramps, these spasms often progress if untreated. They can lead to loss of mobility, joint deformities from chronic contraction falls, and injuries from sudden rigidity, functional decline and reduced independence, emotional distress and social withdrawal. Knowing the risk factors, understanding who is more likely to experience either muscle cramps or pathological spasms is not just an academic exercise. It's a practical step toward awareness, early detection, and appropriate response. Risk factors serve as quiet markers, guiding us to pay closer attention when needed. Muscle cramps are more common in individuals who engage in intense physical activity, especially athletes, manual laborers, or anyone who exerts themselves in hot or dehydrating conditions. People who do not consume enough fluids or essential minerals like potassium, magnesium, or calcium may also be more prone to cramps. In older adults, poor circulation and prolonged periods of immobility can lead to cramps, particularly at night. Pathological spasms, however, tend to occur in very different contexts. They are more likely to affect individuals with underlying neurological or systemic diseases. A history of conditions such as multiple sclerosis, Parkinson's disease, spinal cord injury, stroke, or ALS significantly increases the likelihood of chronic muscle spasms. Similarly, people with diabetes may develop peripheral neuropathy, which can result in abnormal nerve signaling and lead to persistent muscle tightness or twitching. Spinal problems, such as herniated discs or nerve root compression, can also give rise to painful spasms, particularly in the legs or lower back. Additionally, those who take medications that affect nerve function, such as certain chemotherapy agents or long-term antipsychotics, may experience involuntary muscle contractions as side effects. Autoimmune diseases that attack the nervous system, like myasthenia gravis or stiff person syndrome, can further heighten the risk of pathological spasms. Even liver or kidney failure can lead to metabolic changes that manifest through the muscles. In all of these cases, the spasms are not random. They are part of a deeper pattern. In contrast to simple cramps, which usually affect healthy individuals under temporary strain, pathological spasms often emerge in people who are already managing complex medical conditions. Recognizing these risk factors early on can help differentiate between what is likely a benign cramp and what might be a symptom of something more serious. Ultimately, awareness of your personal risk profile is empowering. It allows you or your healthcare provider to ask the right questions, pursue the right tests, and take the right actions. Because behind every muscle's cry for help, there may be a story waiting to be understood. If a person with no systemic illness, no neurological signs, and clear physical overuse has a spasm, it's likely a cramp. But if spasms occur without exertion, with numbness or weakness, or in someone with a complex medical history, the alarm bell should ring louder. When to seek help? A simple rule of thumb: cramps can be managed. Pathological spasms must be investigated. If any of the following occur, a medical evaluation is warranted. Repeated, unexplained spasms without physical exertion, spasms accompanied by weakness, numbness, or tremors, difficulty walking, writing, or performing daily tasks, worsening symptoms over time, lack of response to hydration, rest, or simple remedies. The difference is not just in the muscle, but in the message. One clenches and then releases. The other clenches and holds on to your body, to your function, to your quality of life. The first is a momentary interruption. The eye see. Second is a signal that something deeper has begun to unravel. Reflective summary. When muscles speak, listen closely. The body whispers before it screams. If we learn to listen to the whisper, we may never have to face the storm. By now, you've walked with me through the winding paths that separate a simple muscle cramp from a pathological muscle spasm. They may look alike, both cause sudden tightness, both grip the body with pain. But beneath the surface, they are utterly different conversations with your health. A cramp is your body's way of asking for attention, perhaps for rest, minerals, or hydration. It's a momentary imbalance, quickly soothed and easily forgiven. Pathological spasm, however, is the body raising its hand from somewhere deeper, from a nerve, a damaged pathway, a failing system. It's not just a cry for help, it's a message about something else. Let's gently recall what sets them apart. Cramps are short-lived, often triggered by overuse or dehydration, and respond well to rest and replenishment. Pathological spasms are persistent, resistant to basic care, and often intertwined with neurological or systemic disease. Cramps are inconvenient. Spasms may be dangerous. But perhaps most importantly, a cramp is usually the end of the story, while a spasm is often just the beginning, and so the message here is not one of alarm, but of awareness, not of fear, but of attention. Real-life case illustrations. The faces behind the symptoms. Case 1, the runner's calf. Cramp Jason, 34. Marathon trainer during long runs. Jason began experiencing sudden calf cramps around mile 18. The pain was intense but disappeared after stretching and sipping electrolytes. A blood test showed mild potassium deficiency. With better hydration and post-run recovery, the cramps vanished. Diagnosis: benign exertional muscle cramps. Treatment: rehydration, mineral balance, proper warm-up. Outcome: fully resolved, no neurological. Cause: Case 2. The retired teacher's foot spasms is Lynn, 68. Retired educator. Every evening her toes would curl painfully under her foot, sometimes waking her at night. Initially dismissed as old age cramps, but then numbness crept into her soul. She began tripping during walks. An MRI revealed early signs of peripheral neuropathy from long-standing type 2 diabetes. Diagnosis: diabetic neuropathic muscle spasms. Treatment: neuropathy management, nerve pain medication, foot care. Outcome: improved stability, spasms reduced. With nerve-focused treatment. Case 3. The musician's stiffening hand. Luis, 43. Professional violinist Luis noticed his left-hand fingers stiffening unpredictably during performances. It wasn't pain, it was loss of control. Despite rest and massage, the problem worsened. A neurologist diagnosed him with early-stage focal dystonia, a neurological movement disorder. Diagnosis: task-specific focal dystonia. Treatment: Botox injections, retraining therapy, neuroplasticity techniques. Outcome: return to performance with modified technique. Case 4. The stroke survivor's locked leg. Margaret, 75, post-stroke patient. After a mild stroke, Margaret recovered most functions, except her right leg would stiffen severely during walking. Simple stretching helped little. Physical therapy revealed spasticity from upper motor neuron injury. Diagnosis: post-stroke spasticity. Treatment: anti-spasticity medication, neuro rehab, Botox. Outcome: partial relief. Ongoing therapy required. When to act: a gentle reflection. Sometimes, what begins as a small physical discomfort can grow quietly, unexpectedly, into something more serious. That's why knowing when to act and when to simply observe, is essential in distinguishing between a passing symptom and a sign that your body needs deeper care. If a muscle tightens suddenly during or shortly after physical activity, especially after a long walk, a workout, or a hot day outdoors, chances are you're experiencing a simple cramp. In these cases, rest, gentle stretching, and hydration with electrolyte-rich fluids often bring quick relief. It's your body's way of reminding you to pause and replenish. However, if muscle spasms occur without any clear trigger, especially when you haven't been exerting yourself, that may be a different story. If the spasms begin to repeat frequently, in unusual areas or with increasing intensity, it's time to pay closer attention. Your body could be signaling a neurological or systemic imbalance that needs more than rest to resolve. One of the clearest signs that a spasm is not just a cramp is when it is accompanied by other symptoms, such as numbness, tingling, or muscle weakness. These sensations may point to nerve involvement, and they should not be ignored. Similarly, if your muscle feels stiff or locked in place for long periods, rather than quickly releasing after a cramp, this could indicate spasticity or a deeper neuromuscular issue. You should also be mindful if the usual home remedies, hydration, warm compresses, stretching, or mineral supplements, no longer work or bring little relief. This kind of resistance to treatment is often a red flag that something more complex may be unfolding beneath the surface. Finally, if muscle spasms come with balance issues, tremors, or difficulty walking, writing, or performing everyday tasks, they may be part of a broader neurological condition. In these moments, early medical attention can make a significant difference in both diagnosis and outcome. In short, listen for these quiet clues. Is the spasm tied to clear physical stress or dehydration? Does it pass quickly and respond to rest? Or does it keep returning with stiffness, numbness, or weakness? Are your movements becoming less certain, less fluid? Are your muscles asking for help again and again? Not every muscle spasm is cause for concern, but some are a whisper that grows louder over time. The art of care is not just knowing how to treat pain, it is knowing when to pause, when to observe, and when to seek help. Trust your body. It speaks to you for a reason. Final thoughts. The Kai. Muscle is the messenger, not the problem. Healing begins not when pain stops, but when understanding starts. Your body does not lie. It does not tighten without reason. Whether a cramp calls for rest or a spasm demands deeper inquiry, each is a thread in the fabric of your well-being. To pull at it gently, thoughtfully, is to prevent damage before it grows. Let us not fear what we feel, but let us not ignore it either. A single spasm may pass like a wave, or it may be the first ripple of something larger. So, the next time your muscles speak, pause, stretch if needed, rest if tired. But, most of all, listen.